we understand as ENT doctors that ear tubes are a surgery, and that can sound scary. And I've been through this myself. One of my kids had ear tubes, and the procedure is very quick. It's done under a very, very quick anesthetic. There are, newer techniques where doctors are trying to put ear tubes in the office, and that sounds interesting and is probably very necessary in certain cases, but most of the time, if you ask an ENT what would they do for their own child, the brief anesthetic is what we would choose. Why? Because it's painless and there's no recollection, and we can very carefully place the tube exactly where we want it. And it also lets us, under a brief anesthetic, wash the ear out, get the infection out. There's usually trapped mucus and sometimes pus. We can wash that out, and then we can carefully get the tube in and then put the medicated drops in. And so for all those reasons, if we get to the point of putting in ear tubes, then we want to do that under a brief anesthetic. The tubes generally stay in for about a year to year and a half and fall out on their own. As I said, children can still get ear infections, but they can drain while the tube is in. Rarely the tube doesn't come out when we want it to, either too soon or stays in too long, and then we can remove it or replace it if necessary. But usually we get our year to year and a half out of them. Tubes come out, the child outgrows the ear infection, and then we're done. 1 out of 5 children who gets ear tubes will have ear infections after their tubes come out, and we will consider a second set of ear tubes. And in those cases, we might consider a second procedure that's called an adenoidectomy. And an adenoidectomy, that's a procedure that's trying to actually help the eustachian tube to work better, because the adenoids are located down at the lowest end of the eustachian tube, and when they get big, usually in kids that are 3 and 4 years old, they can block the eustachian tube and also cause stuffy nose and sinus symptoms.